Maldonado, a student at Maryville University in the FNP program, and today I'm going to complete my head-to-toe assessment with my volunteer here, Chad. Before coming into the exam room, I got a full set of vitals, his height and weight, had him empty his bladder, and watched his gait as we walked into the room. We also tested for distance vision. He was 20/20 in the right, left eye, and both eyes together using the Snellen chart. We now walked into the room. I have washed my hands, and we will begin the exam. So initially, I'm going to look at his appearance, looking at his head and face, looking at his facial structure, symmetry, everything like that. Everything looks equal. Skull, no lesions, anything like that. I'm going to go ahead and palpate his skull. Hair staying in well, doesn't feel like anything abnormal. Going to move down toward his facial bones. Going to palpate for his TMJ. Go ahead and open your mouth and close. No popping, no pain. Okay. I'm going to palpate his sinuses, frontal and maxillary. And while I'm here, do his lacrimal apparatus. Good. Okay, go ahead and look at me. I'm going to test some cranial nerves. I'm going to ask you to smile. Clench your teeth. Raise your eyebrows. Puff out your cheeks. Stick out your tongue. Move it left, right. Awesome. Okay, now go ahead and close your eyes, and we're going to do some sensory testing. Tell me when you feel this.
I feel it. Feel it. Feel it. Feel it. Feel it.
Good. All done. Okay, next we're going to move on to your eyes. Looking at your conjunctiva, everything looks good. We're going to test to see how your eyes react to the light. So go ahead and look straight at me. I'm going to shine this light, and we're going to look indirectly and directly for reaction. Good. Perfect. So both eyes were equal and reactive to light. Next, I'm going to test your cardinal fields of gaze. So look at me and follow my fingers with just your eyes. Good. And I'm going to also test for nystagmus or any involuntary eye movement. So I want you to go over and cover one eye. Look at me. Now uncover. Good. Now do your other eye. Look at me and uncover. Very good. So no involuntary eye movement at all. So we're finished with your eyes. We're going to go ahead and move on to your nose. Here I'm going to just be looking at your mucosa, looking at to see if you have any deviated septum, any turbinate issues. So go ahead. Let me look up. Good. No issues there. Next, we're going to move on to your mouth. I want to go ahead and look inside and open up. Looking at his teeth, or any cavities, dental decay, everything looks good. Hard and soft palate, look okay. I'm looking at his tongue for symmetry. Lift your tongue up, look good. I'm going to also stick this tongue depressor in. Say ah. Saw the uvula rise, everything was good there. We could also test the gag reflex now, but we're not going to. The uvula rising counts as well. Okay. Next, we've completed your whole face, so now we're going to move on to your ears. I'm just going to be testing for general ear sound and whatnot. So first, we're going to do some testing for your ears. I'm going to ring this. This is a Weber test. I'm going to put it above your head, and let me know if you hear it on one side, both sides, or equally.
Both sides equally.
Good. So now we're going to do ear to bone conduction, bone to air conduction. So I'm going to place this behind the back of your ear. Let me know when you don't hear it anymore. And I'm going to place it here, and let me know when you don't hear that.
And I don't hear anymore.
it should be. It should be a 2-to-1 difference. There's a few more hearing things I'm going to do. It's called the whisper test. So I'm going to have you cover this ear, and I'm going to stand behind you and tell me what word you hear.
Cat.
Okay, uncover and cover your other ear.
Dog.
Very good. So finally, I'm just going to take a look inside your ears, palpating them, the auricle, no nodules or bumps. And then I want to look at your ear canal and your tympanic membrane. Looks good, no redness, swelling. Tympanic is nice pearly gray. And I would do that on both ears normally. One last thing I forgot to do, I'd like to test the patency of your nose. So if you could go ahead and cover one nostril and breathe in and out. And do your other nostril now. Good. Okay. So we've completed your head. We're going to move down to your neck now. So I want to go ahead and test the final cranial nerves. So go ahead and shrug your shoulders for me. And down. Good. Move your head this way and against my hand. Good. Against my hand. Good. And tilt your head side to side. No pain? Okay, good. So now, upon inspection, neck looks equal. You can see midline trachea, everything. So I'm going to go ahead and palpate now. I'm going to start with your lymphatic system. So I'm going to start with your preauricle lymph nodes, your postauricle, submental, submandibular, down your cervical chain, the clavicle ones, pre and post. And while I'm here, I'm going to do the axillary. Okay, I couldn't feel any of those, which I shouldn't at this point in time. I'm also going to palpate one at a time your carotid arteries. Good. Good. I'm also going to palpate your trachea. Go ahead and swallow for me. Good. One more time. Good. No issues there. Okay, finally, I'm going to listen for any buoys on your trachea or any of your on your carotids, okay? Very good. Okay, so we're done with the neck now, so I'm going to go toward, start with your lungs, and we're going to start posteriorly. So if I could have you scoot down a little bit. Okay, and turn towards me just slightly, so you're at an angle. Good. Okay, so we're going to start posteriorly with the back, looking at his thoracic cavity. Everything looks good. Doesn't look in distress with his breathing at all. I'm going to test for expansion, so I want to take a deep breath in and out. Good. It's equal and symmetric. Next, I'm going to test for tactile fremitus. Can you go? I'm going to place my hands on your back and say 99 a few times.
99. 99. 99.
Good. No issues there. Now I'm going to go ahead and percuss down his back. Okay, and then we're going to test his diaphragmatic excursion. So go ahead and take a deep breath in and out, and then hold that. Okay. Okay, and I would mark that right there. Now you're going to go ahead and take a deep breath in and hold the breath. And then I would mark that, and it appears to be within normal range of 3 to 5 centimeters. While I'm back here, I'm also going to test for CVA tenderness by your kidneys. So I'm going to just tap. Any pain with that? Okay, good. So then finally, I'm going to go ahead and just listen to you posteriorly. So go ahead and just take nice, big, deep breaths. Lung sounds were nice and equal. He was aerating fine. No crackles, rhonchi, or any other issues going on there. Now we're going to move to the anterior side to look at his lungs and laterally. So go ahead and turn this way again. So once again, now I'm looking at his lungs visually. He's still not in any distress. He's breathing fine, normal rate. I'm going to go ahead and listen laterally and then anteriorly. And at the same time, I'm going to go ahead first and listen to his precordium, feeling the chest wall, his apex, for the apical impulse. And so now I'm going to listen his lungs anteriorly, laterally, and listen to his heart sounds. So just regular breaths now. And now I'm going to listen to his heart sounds. Okay, good heart sounds, no murmurs. I heard a good S1, S2, rate and rhythm sounded good. So that completes your heart and lungs. Now we're going to move on to your abdomen. If I could have you lay down on your back. Feet down. Very good. We're going to pull up your shirt a little bit. Okay, so initially I'm just looking at visually his abdomen, seeing his abdominal muscles, looking at it. Doesn't look like there's any abnormal masses. It looks soft. It's not raised or anything like that. Then I'm going to go ahead and listen to his vowel sounds first. And then I'm also going to listen to his arteries, the aortic, his renal, iliac, and femoral arteries. Okay, everything sounded good there. Next, we're going to just start off with a little percussion around the whole abdomen to get a sense of everything. Okay, then I'm going to go ahead and percuss his liver borders at the mid-clavicular line. Okay, and then I'll do it down. Okay, this appears in normal range. Then we're going to also percuss his spleen that should be dull. Very good. Then I'm going to start with a little light palpation. Let me know if you feel any tenderness. Good. Then we're going to go ahead and feel for his liver border. Right there. Shouldn't be able to feel his spleen. And then we're going to try and feel for his kidneys. So I put one hand under. And finally, I'm going to feel for any aortic pulsation. Okay. Nothing abnormal there. So we have completed the abdominal exam. I'm going to go ahead and have you sit up again on the side of the. And we're going to move on to upper and lower extremities. So visually, once again, looking at his upper extremities, equal hair distribution. He has some nevi, nothing, no abnormal moles, good color, skin tone. Going to test his capillary refill within normal limits, less than 3 seconds. Same on this side. Going to go ahead and feel his brachial pulses and radial. Going to do a little strength. Go ahead and arms out like this. Push up. Good. Push down. And same, now put your arms out. Push up and down. Very good. Then while we're here, I'm going to test your brachial reflex. Just relax. Very good. We would do that on both sides. Now I'm going to move on to his lower extremities. Once again, looking at equal hair distribution. No edema, no swelling. Going to feel for his popliteal pulse, his tibial pulse, and his pedal pulse. All good. And I'm going to also test his knee reflex and his Achilles tendon. Okay, very good. So finally, I'm going to take a look at his spine. I'm going to have you stand up, sir. Turn around. I'm looking at his cervical spine. Feels straight. There's nothing abnormal popping out. And then I'm going to have him bend over and look for symmetry. So go ahead and bend over, touch your toes. No curvature, no S or C shape. Looks like in a good line. Go ahead and stand up, sir.